Hello, my name is Johnnie Nichols, and we're working to heal the hurt by addressing the mental health of juveniles in the juvenile justice system from lower socioeconomic environments. First, let's discuss the issues and trends. Youth from lower socioeconomic backgrounds involved in juvenile justice face severe mental health challenges. Common mental health conditions are anxiety, depression, PTSD, conduct disorders, amongst other things. Things that help push this along are drug misuse, community violence, and spousal abuse that are witnessed by our youth. There are a couple of theories that I would use to address these issues, which one is CBT or cognitive behavioral therapy, effective for treating conduct disorders, depression, and anxiety by changing dysfunctional thoughts and behaviors. In addition is Erickson's stages of psychosocial development, which is a theory proposed by Erik Erikson himself that outlines 8 stages through which a healthy, developing individual should pass from infancy to late adulthood. Prevention stages. School-based mental health programs, early intervention through CBT programs, and social emotional learning, or SEL, which is a curriculum integration to support resilience, emotional control, and coping skills. It is highly important for early intervention and detection of these issues, which helps keeps youth out of the juvenile justice system if programs are in place to help mitigate their issues before they even get into trouble. Intervention strategies. There are individual and group CBT promoting healthy coping strategies by addressing problematic thoughts and behaviors. And there's family therapy, improving family dynamics and communication. Both individual and group CBT settings have unique advantages. Many clients benefit from a combination of both, where they can receive personalized attention in individual sessions and gain additional support and perspective in group settings. This combined approach can enhance overall treatment outcomes, providing a comprehensive and well-rounded therapeutic experience. Developing appropriate techniques. The preschool age, we would utilize play therapy for expressing emotions. The primary school age, behavioral interventions with positive reinforcement. Middle school, social skills training to navigate peer relationships. And high school, career counseling for goal setting and motivation. Then we go to the advocacy and referrals. Promoting comprehensive mental health services in school and securing funding is advocacy for the youth. Extremely important. What's also extremely important is connecting families to community mental health services and substance abuse programs that may help that family get into a better place across the board. These two things are detrimental to the mental health resources for our children. We also have to understand diversity and culture. Respecting diversity is in age, gender, culture, and ethnicity. Culturally responsive counseling practices, addressing cultural stigmas and fostering an inclusive environment. In today's diverse society, cultural competences in counseling is more important than ever. As counselors, we encounter clients who from various backgrounds, each have their own unique experiences, values, and belief systems. Cultural competence means more than just awareness. It is about actively understanding and integrating this knowledge into your practice. Firstly, cultural competence enhances the therapeutic alliance. When clients feel understood and respected, they are more likely to engage openly in the therapeutic process. This trust is foundational for effective therapy. By being culturally competent, counselors can avoid misunderstandings and build stronger, more empathetic connections with their clients. Secondly, it leads to more accurate assessments and interventions. Different cultural backgrounds can influence how clients express their symptoms and cope with challenges. Now, how do we integrate faith? Integrating Christian faith with counseling practices. Scriptural guidance for promoting forgiveness, compassion, and hope. These things are crucial. Being able to integrate the word along with therapeutic practices not only helps build a foundation, but it also gives hope. to the youth that we're trying to serve. Conclusion. Emphasis on the importance of a comprehensive approach to address the mental health needs of juveniles in the juvenile justice system from lower socioeconomic backgrounds. The critical role of school counselors is in implementing effective prevention and intervention strategies. The significance of advocacy, culturally responsive practices, and integrating Christian faith in counseling. We begin by exploring the significant mental health challenges faced by juveniles from lower socioeconomic backgrounds involved in the juvenile justice system, highlighting issues like anxiety, depression, PTSD, and contact disorders. We discussed the importance of addressing adverse childhood experiences and the systematic barriers these youth face in accessing mental health care. We looked at the theoretical framework explaining the application of CBT in Erickson's psychosocial development stages in treating youth that have these issues. And we emphasized the importance of these theories in developing effective prevention and intervention strategies. Developmentally, appropriate techniques we discussed, and we detailed various techniques appropriate for different age groups, from play therapy for preschoolers and career counseling for high school students. And we talked about advocacy and referrals and highlighted the importance of school counselors advocating for comprehensive mental health services and collaborating with community resources. Respect for diversity is going to be huge in our work as therapists or school counselors. We stress the need for culturally responsive counseling practices that respect and integrate students' cultural backgrounds into treatment plans. And we discussed how our faith in integrating Christian values such as forgiveness, compassion, and hope can support the counselor's process. Understand the impact of the school counselors. We concluded with the pivotal role that school counselors play in supporting at-risk youth through a comprehensive and compassionate approach, thereby positively influencing their mental health and overall well-being. Here are my final thoughts for the class. We need to reinforce the need for a multifaceted strategy that includes theoretical understanding, practical techniques, advocacy, and respect for diversity to effectively address the mental health needs of juveniles in the justice system. Thank you.